I'm Yolanda Gotier, and I'm the Senior Living Health and Wellness Navigator for the Center for African American Health. The focus of the Center for African American Health has been for over 20 years a focus and commitment to improving the health and well-being of the African American community. So, of course, that would include our elders. We pride ourselves on being able to provide community-based, evidence-based disease prevention, disease management programs, and events for our community. So one of the things that I would say is that the issues have exacerbated as a result of COVID-19, but for many in our community, they continue to have, of course, health disparities, which is being proven or highlighted by the impact of COVID-19. But additionally, food sourcing and resources, because many of those who live in our communities live in food deserts, and the need for housing, affordable housing, as well as access to housing. So one of the things that happens when individuals become older, if they have decided that they're going to downsize, it's being able to find something that is affordable and does not take all of the savings that they have worked years to be able to have. And then the other is for those who maybe they were renters all of their lives, and so they don't necessarily have the necessary finances to be able to do deposit, first and last month's rent. We're also just looking at their health care as well as how they are being connected and to whom they are being connected within the community. So by that I mean, what does it mean for an elder who might be living alone? Are they connected to a senior recreation center? Are they connected to a senior living center? Do they have church connections? Do they have neighbors who check in on them? Especially if they don't have children who are able to do that, adult children who are able to do that. I just really feel like people should not ever have to leave their communities to get the resources that they need. I would say I am just passionate about the life, excitement, and activity that older Americans have. Now, of course, I'm getting there. I won't say how much longer it'll be until I consider myself an older Coloradan, but however, just the zeal and the zest that the individuals I've worked with approach things. As much as I probably didn't appreciate COVID-19 and its restrictions, I also found so much to be grateful for. And that I attribute to the people that I've worked with. Because they're just saying, we just need to stay in the moment and we need to work with the moment. So, one of my watch phrases for 2021 is that each day 2021 happens. We create it each day. And for me, not to sit up and try and plan out a whole year, because that may or may not happen the way I am planning it today. So, I definitely have gotten that from the community that I've been working with. But it is about me being able to provide what I can, where I am, where I stand for those who are in need of the services. And if I can't find it, I'm going to research until I can find somebody who can find it for me and help me with that. So I know I can't do it by myself, and I need everybody to help. So that would be one of the things I would say that I'm passionate about.